So video number 2 about how my sessions get started. Towards the end of the first session, the intake, the talk, the getting to know, we're talking a lot about, or often we're talking a lot about, what's to come and how these guided physical exercises, are going to be a big part of what we do. And so at some point, I gauge it and just move over slightly. I have like a L-shaped couch. And so I move over closer to the patient and I present my hand to them and I say, take my hand in the moment, so they can't really think about it. And I ask them to take my hand in one or both of theirs and to close their eyes, breathe, and just explore it, just feel it, that's all. And take a few minutes. And then once they've done that, we reverse it. And then I do the same thing. I touch, exploratory kind of touch of their hand. Then I sit back and get back into the space that I was in on the couch. And I just check in and say, how was that? And, they're usually pretty shocked by having I cross the physical barrier, basically, and I do it quickly. So, of course, like I said, so they don't have time to think about it and get nervous. And the way that they connect with me or don't connect with me physically reveals where a person's at or not at. And that's okay. So some people pat the hand, some people just sit with it and don't move, some people squeeze really hard. It's very many varieties of touch. And sometimes the hand is wet or clammy, scared. A lot of things I pick up from the physical touch, and then also it's giving, so it's the whole point of giving and receiving, which is what we're going to be doing down the road, which is we're going to give touch, and they're going to initiate first, and then I'll explain the exercise, they initiate, and then then they receive, so give, receive, two sides of the same coin. And, I just ask them how they feel, what they sensed, what felt a little bit more fluid, giving or receiving, just to notice, discovery. Then, so then I move into, for the second session, I let them know in advance, that will be the beginning of all the sessions coming up after this first one will be, we'll talk in the beginning, and we'll explore how the effects of the last session that we had, permeated their being, how they processed it. Maybe some other things came up, maybe some things that they hadn't thought of in the archives of their mind, came forward after the fact. They want to share more about their history. Many things can happen during a week. In my view, when you're not in therapy, you kind of are, because you're still processing everything. So, and living with it. And so then after, I gauge it, 20 minutes usually, we move to the floor. So in the first session, I have a table in front of us. And the second session, it's gone, and there's just an empty space. And so I have a mat, and I put it down on the floor. I put a sheet on it, and we sit on the floor, take our shoes off, and we begin to explore the tools of what we will be using and exploring throughout the entire process together. So I'm introducing them. And I've talked about this before in other videos, so I'll just briefly go through it now. If you want to go back and look, you'll get more in-depth about exploring these tools. But the main is developing a breath practice, discovering, a deepened breath practice to absorb more oxygen and be able to inhabit the body with more ease, be more grounded. So we experiment with what is a breath practice, why are we doing it, how are we going to use it, and then I break it down into the different parts of the breath and how to visualize to help go in and get the most from it, and basically just have them try it out. So we practice together, so breathing, noticing, how their body is allowing breath in and out, and then I give some suggested homework so that they can practice. It's muscle memory here, right? So the more that you practice something physical, the more you don't have to think about it after a while. The breath will be used all the time. Every session starts with breath after this session. Once we hit the floor, ground into the floor, and to center, get out of the confines and the grip of the mind, and be able to inhabit the body. And then the second tool is exploring what is sensation-focused touch, sensate focus. Basically, it's, here's my hand, touch it, feel it, like you don't know what it is perceptively, and then start to describe, the textures, temperatures, actual sensation. And I ask them to verbalize so that, they actually stay focused. If you don't verbalize, your mind will move away from the focus much faster. And I start with some parameters basically, which are that since I'm introducing these up front and we're going to be using them, I share that one, eyes are closed when we're doing the actual touching because when the eyes are closed, a person is less distracted by what's around them. And also when one of our senses is not in play, the other senses potentially are more enhanced. This is scientifically been explored and proven. So we want to get the most out of the sensation of touch and focus. So that's two reasons. The other is that another piece I put in place is at the front is that we will always, I will share what the guided touch exercise is. However, I will always ask that the patient go first. And I ask them why they think so. And the real simple reason is so that they're not mimicking me, so that they can really just explore and learn. And that's what it's all about, discovering how doing this feels in their body and what happens in terms of what does the sensation or the experience bring up for them, and what they actually feel. Anxiety, where they feel it in their bodies, that kind of thing. So that we do that. So then once they've explored my hand and described what they feel, hand, arm, maybe up to the elbow, then we reverse it and I do the same thing and I notice, how they receive. Is their hand really stiff? Are they, there's a lot of unconscious stuff like the sweatiness I mentioned before in the hand, or the tightness, the resistance, even slight or subtle. These are all kind of, physical, nonverbal indications of, where a person's at in terms of connecting with touch with another person. So that was a bit longer than I expected, but anyway, that gives you a little idea. Any other questions about any aspect of what I do, and if you look back, it could be about one of the subjects, like in terms of if you have questions about any of the conditions or any of the problems that I've talked about that people are faced with, and seek out this kind of help. So thank you for listening, and have a great rest of your day. Take care.